Good morning. It's Friday, March 18th. Welcome to the Morning Medical Update. I'm Alexis Delcid in for Jessica Lovell. Thank you for joining us on Facebook, YouTube, and now on Twitter. Today's show is pre-recorded. Now, we normally do not do this, but this topic is so important, and our guests will be enjoying some much-needed time off when the show does air, so we wanted to be sure to snag them while we had the chance. Coming up today, gas prices are soaring, and it's also costing more for things like food and other supplies, and some people are having to make the tough choice between food, gas, medicine, or medical care. We're going to look at the options available to you, and at the same time, blood and food supplies are also low. We have an update from Harvesters, the Community Food Network, and the Community Blood Center. We're going to share how they're teaming up together to help people in our community. We don't have a COVID count today because Dr. Hawkinson's also enjoying some much-needed time off. The show is pre-recorded. However, we will be back with a current live count on Monday morning. We also want to bring you a check of your medical headlines. Let's start with this. Pfizer's announced the start of tests for its COVID-19 treatment pill, Paxlovid, on children under the age of 18. Researchers want to figure out if the 5-day treatment can keep children who are infected with the virus out of the hospital. If the trial shows positive results, the company will seek FDA approval for the antiviral to be prescribed to children under 12. Air pollution is hurting more than the lungs of pregnant women. Researchers with Hebrew University of Jerusalem found air pollution is associated with low birth weight as well. And it also revealed that mothers who are underweight and mothers from lower socioeconomic status are more vulnerable to air pollution exposure. Now to diabetes. Millions of people have diabetes, and the number is greater among Black and Hispanic Americans. A recent study showed that many Black and Hispanic Americans have type 2 diabetes. This is a series of studies showing this. The risk for diabetes is also a whopping 77% higher for Black Americans, 66% higher for Hispanic Americans. If diabetes is not managed, it can lead to things like blindness, limb amputation, kidney failure, heart attack, stroke, and even death. Studies suggest that people in those groups that are at higher risk are less aware of diabetes symptoms. Maybe they don't have their diabetes under control, they lack health insurance, or they experience difficulty accessing quality care. Speaking of care, to today's topic, we know so many of you are going to have questions during this discussion. So please feel free to send all your questions in to us on YouTube, Facebook, and the Medical News Network, and on Twitter. You can find links to those right there on your screen. We will be having our experts answer them next week when we are back live, so please send us your questions. Make no mistake about it, it is costing more these days to fill up your gas tank. We all know this. It's costing more to keep your pantry stocked, making sure you have all the medications you need. Healthcare is not cheap. Look at this graphic. According to the Kaiser Family Foundation, the average cost for health insurance premiums alone for a single person, $7,400. That doesn't even include copays and medicine. For families, the cost triples to $21,000. Nobody should have to choose between eating, putting gas in the car so you can go to work or pick up your child at school, or your medication. We want to help you avoid having to make that choice. Joining me this morning is Colette Lasack, the VP of Revenue Cycle Operations at the health system, and Colleen Booz Dittrich, a social worker in the health system's continuum of care. As I want to start with Colleen. As a social worker, you have probably heard some really tough stories that people have shared with you about having to make these decisions between medicine or putting gas in their car or going to the grocery store.
Yes, it is daily for us to hear concerns from patients and our families shared at the bedside or in our clinic settings about these concerns. It's really important that we start to become more comfortable talking about these concerns as well, because this enables us to assess for need and link patients to different resources that we have both in the health system and the community to try to address those needs. We've seen a growing increase as well as we screen for social determinants of health and looking for vulnerabilities of patients being able to have successful outcomes related to their health care. A higher percentage of patients are screening both for social isolation, which we can appreciate during the pandemic, as well as financial concerns. And that can be related to medication cost, transportation, affording copays for doctor's visits, and other treatment costs that they need to pursue based on physician recommendations.
We always hear of people who start to even ration their medications.
Yes.
Before you even think about doing that, though, there is a solution that can also save you money and hopefully enable you to be able to get all your medication, and that would be choosing an off-brand or a generic brand. How much money can that save?
Potentially, that is a great option for many patients. I always advise people to share those concerns with their physician and their pharmacy team to explore what option might work best for them. There are disease-specific grants locally and nationally that we rely on sometimes to help patients afford costs. There are $4 and $12 lists at most pharmacies, which can offer a reduced cost for many common meds. There's a variety of ways that you can figure out what medication you need to be on and what your cheapest option is that's available.
In addition to the grants and the prescription help, with gas so expensive, a lot of people just can't make it to their appointments. If they're having to go somewhere every day, is there transportation help available within the health system or any kind of resources?
Yes, there can be, depending on the need of the patient and the distance. We have resources in the community that we often link patients to who have a long-term transportation need, and that is a gap that they have in their ability to successfully get back and forth to treatment. So if we know somebody has a long-term treatment plan, we really work to link them to a resource that can provide that transportation. We are also fortunate in our health system to have grateful donors and employees who have donated monies that we use through our endowment funds, and we can do limited transportation assistance with a bus pass or a cab pass to help somebody with a one-time need or a short-term need while we look to bridge to long-term resources.
Earlier you said something that got my attention about people needing to feel comfortable in expressing that they're struggling. Are there people, do you think, who are silently suffering and making choices they might not even have to make because they're just embarrassed and they don't know they can ask for help right at the front desk when they're checking out or when they're sitting in the doctor's appointment?
I do. It's hard to know who to talk to, and I think our patients and families sometimes are scared to share that vulnerability. And one of the messages that we want to share with our community and all of our patients who receive care here is please share any concerns that you have related to your ability to afford care. We have a variety of different roles and programs in our health system that can help you depending on what your needs are. And we definitely want to be able to have that opportunity to be creative with those patients and really make sure that they have the access to care that they need.
Finding the right health insurance plan can also be a nightmare. It's like trying to learn a foreign language for a lot. I mean, it's very stressful. Can people get help figuring out a better insurance plan for them? And who would they ask about that?
That's a great question. What I do know is that we have people within our health system who are trained at knowing those healthcare plans very well. And if a patient is uninsured and looking to find insurance, we have the ability to potentially connect them to those resources with information and somebody who can help them get set up with an insurance plan. We also know in the community that there are agencies who their area of service is to help people look at their insurance plans and figure out what might be a good fit for them. And I encourage people to use that resource as well.
Because there are people that do that for a living, so that you can actually do what you do for a living. And not spend 8 hours trying to decipher a plan or multiple plans. I want to bring Colette into this discussion. Colette, you're with the retirement system here at the health system. Budgeting is so important now more than ever with what we're facing. What types of things do you suggest for people to make sure that they're putting their money in the best places?
Yeah, absolutely. And you know, great comments from Colleen. We definitely have staff from a revenue cycle perspective that help those patients find the right insurance. And we do have some great local insurance agents that we connect with on a daily basis to help patients find the right insurance. But to also ask your bigger question about what else can patients do, it's really about making sure you're living within your means. I think we all have to do that every day. And we're adjusting. I think as we see gas prices go up, as we see food prices and daycare prices go up, that we really sit down and evaluate that in accordance with your family and how does that fit. And sometimes at the bottom of that list might be, how in the heck am I going to afford my insurance premiums? As Colleen said, don't hesitate to reach out to us. We are here to help. We partner closely with Colleen and her group to make sure that we've got resources available to help patients. But, when you think about your own personal budget, really sit down and make sure that you know where your income's coming in and where it's going to. We always have this role too that we help our own employees with, which is, how do you pay yourself first? How do you make sure that out of every paycheck, can you put money away? Every dollar counts as you put away for those rainy day funds, and make sure that you're maximizing everything you can. If you do have a retirement fund or pension funds available to you, that you're really maximizing everything that you can.
So to piggyback on what you were saying about living within your means, could you give us some examples of things that we could all probably cut back on right now, or even hold off on buying, that would save us some headache in the long run?
Well, I think those are great questions, right? That we all deal with every day. And as Colleen said, don't let your medication and your healthcare be on that list. Come talk to us. We're going to help you find a way to make that happen. We don't want folks to miss screenings or skip medications that might lead to a worse outcome in the end. But I think for all of us, and I'm doing this even with the new year, what online subscriptions do I have? What am I paying for my phone? What am I paying for my TV? There's a lot of hidden costs that I think that we all find in there. And I think the other piece is insurance. Really understand, what are you paying for your insurance? Sometimes you can get a much cheaper premium if you choose a higher deductible plan. So we look at that all the time, both not only just in healthcare, but we should be looking at that, whether it's car insurance, homeowners insurance, those types of things. But there can be a lot of hidden costs just in your daily life.
Sure.
That you can be scrutinizing to see where those dollars could come from.
I mean, one way that my family and I saved, I think, a ton of money is bringing our lunch. Rather than buying lunch every day at work, if you bring your own lunch, you'd be surprised, I mean, maybe not, about how much that adds up. Colette, when it comes to budgeting, do you have a ballpark amount or a goal of a certain amount that would be good for a person or a family to set aside at the start of the month or even the start of the year in a flexible spending account for things like healthcare and medications?
I always, when we're helping patients put those types of budgets together, is to really, what can you anticipate, right? Knowing what your healthcare needs are, what are you paying out of pocket for prescriptions? What are you paying out of pocket, even for other medical care, whether that's over the counter prescriptions, glasses, anything that you could actually turn in on that health savings account. Make sure that you maximize that and monitor it through the year. There's nothing worse than setting aside those dollars and then you don't maximize them in your plan. Right. So be sure you're monitoring that through the year. But I always tell folks, I don't think there's a magic number. You need to understand what your anticipated costs are for the year, and then maybe a little bit more, just for those unexpected expenses that might come up.
The pandemic and all the other world events are affecting pretty much every facet of our lives. And we have two other very important topics since the pandemic hit. Fewer people have been donating blood. And for places like the Community Blood Center, they may only have a 1 or 2 day of blood supply on their hands. Jean Hallinan is one of the many people in the metro in need of a blood transfusion. And Jean might be a familiar face to you because she's also the communications manager for Harvesters, the Community Food Network, and she's a breast cancer survivor. And in full disclosure, she happens to be the wife of our beloved teammate and MMU executive producer, Bob Hallinan. We just adore Bob and Jean. Now, this one-time blood donor, though, is finding herself on the other side because Jean is tackling leukemia now.
I've given blood in the past, and I never, ever thought that I would be one that would be receiving it today. I am so grateful that the Community Blood Center is here to help patients like me and other patients.
We're really happy to report Jean is doing okay this morning. And if you would love to help people like Jean and so many others here in the community blood bank is now teaming up with harvesters. They want to increase blood donations and get more food to families who are hungry. Joining us now to talk about this new program is Amy Pinger with Harvesters and Chelsea Smith with the Community Blood Center. Thank you both for being here. Chelsea, I want to start with you because the lack of blood not only impacts hospitals, but those who need transfusions for surgeries, people like Jean. You have a 1 to 2 day supply. How much of a blood supply do you typically need and feel comfortable having?
Yeah, so right now we're actually sitting around, it hovers around a 2 to 4 day supply, depending on the day. We do need to have a 7-day supply. Our goal is to have a 7 to 10 day supply on hand at all times. Unfortunately, we've not had that since the onset of the pandemic. It has been very challenging for us. We know we're not the only community organization who's faced challenges like this, but we've seen decreased blood donations across the last 2 years directly related to the pandemic. We see donations take a huge drop when our COVID cases go up locally. It's been very challenging, and we're hoping that in 2022 we're going to get back to that 7 to 10 day supply and be a little bit more comfortable in being able to supply our hospitals here locally.
You have a very unique blood drive coming up. I want to know if you could tell us about that and explain how the idea for this blood drive came about.
Yeah, so we are currently in the midst of the Save One, Feed One campaign. This is in partnership with Harvesters Community Food Network here in Kansas City. So all donors throughout the month of March have the ability to go online to savealifenow.org/SaveOneFeedOne, and they can register their interest for us to donate $1 to Harvesters on their behalf. So that's every single blood donor. CBC will donate $1 to Harvesters, which actually feeds 3 people. Amy can speak more to that side of it later, but yeah, just $1 donation can actually provide 3 meals to people in our community that are struggling with food insecurity. So this actually came about because we were abundantly aware that we're not the only organization that's been deeply impacted by the COVID-19 pandemic. So for us, donations have gone down, but for Harvesters, the food insecurity has been on the rise throughout the pandemic. So we sought a partnership with them actually last year in October, and it went pretty well. And we thought, let's do this again. Let's make it a month-long campaign so that we can try and both encourage blood donations, but also raise awareness about food insecurity and the need for food donations as well.
How do people sign up to be part of this, and are there any restrictions or requirements?
Yeah, so you can sign up at savealifenow.org/SaveOneFeedOne. There you're going to find a link that allows you to say, yes, please donate $1 on my behalf to Harvesters, and then come in and donate during the month of March. And we'll be able to donate on behalf of those donors. In terms of restrictions, the restrictions for normal blood donations would apply here. So sometimes if you're on medications, that might defer you. If you've traveled out of country recently, that could defer you as well. There's a host of reasons that you might that might apply to you in terms of not being able to donate blood, but actually most people can. So we encourage, if you have not donated before or are unsure whether or not you'd be eligible to donate, you can go online to savealifenow.org to find more information, or give our medical team a call at 800-688-6844.
Amy Pinger, I want to bring you in because you're a longtime blood donor. You work for Harvesters. And one of the amazing things about Harvesters, among so many things, is how you guys stretch $1. To hear that $1 feeds 3 people, that is remarkable. How are you able to do that?
Yeah, we are lucky to have a network that we work with. We are the Feeding America Food Bank for this region. And so that opens up access to food supplies that we may not have had on our own. And so we know that the need has been high. We've had very generous community support throughout this pandemic. But really at the height of the pandemic, we were seeing about 40% increase in the number of folks who are coming to us, and a lot of them for the very first time.
That is so, it's gut-wrenching to see the lines. And I remember the start of the pandemic, you'd see the news helicopter shot of all the people lined up in the parking lots who were just there so they could feed their families. With this drive, the Save One, Feed One, how many people do you feel like this has the potential to help who are right now sitting with their children at home and they're hungry? They don't have enough to eat.
Yeah, for sure. We've got quite a number of people in our community that really are food insecure and are really struggling to figure out where that next meal comes from. And so, putting an exact number on it is challenging. The need has dipped over the last 2 years from that peak at 40%, due to federal funding and programs like the stimulus checks and increases in SNAP funding. But all of those have ended at this point. And so now we're looking at that need jumping back up again. So just in December, we distributed 30% higher than we did pre-pandemic levels for December.
Wow. If someone watching can't donate blood for one reason or another, but still want to donate or help harvesters, what do they do?
Yeah, absolutely. We have barrels in our local grocery stores, and that actually has been a tremendous partnership throughout the pandemic because folks can go and buy some food for themselves and then put additional food in those barrels, and that can help us. Every dollar helps us to provide 3 meals to the community. And so I think a lot of times people hear those numbers and they are overwhelming and don't think about the small things that they can do to make a difference. Because if each one of us did a small thing, it really would add up.
Just if each one of us donated $1 or just grabbed a can of food at the store, that could make a huge difference. I want to bring in all of our guests now for our final thoughts. We have covered a lot of important and tough topics this morning. Colette, I want to start with you.
Yeah, I think final message is, please call us. If you're in need with help with your medical bill, if you're in need trying to secure insurance coverage, or you're worried about how to secure that next pharmacy visit that you need, give us a call. We're here to help. We partner very closely with Colleen and her team, and we'll get through this. We're here to provide great care, and we're here to take care of you.
Colleen, thank God there are people like you and our teammates that we're talking with right now that are able to help people. What are your final thoughts?
I would echo what Colette said as well. Please talk to us about your concerns. We are here to help. We can get very creative with solutions. And I also really want to thank our community partners that are on today. We rely on you so heavily for that linkage to the community resources to help patients find their full potential and having access to resources and basic needs that they need to be able to be successful out in the community. And we appreciate you and we thank you for all that you do.
People want to help.
Yes.
There's a human component here. Everybody wants, if you say to someone, I need help, they're going to want to help you.
Yes.
Amy, what's on your mind as we close out the show?
For me, it's being compassionate to those who are in need and understanding that it does take a lot of courage to ask for the assistance that you need. And so when folks do have the courage to come forward and share those needs, just being available, and also not getting overwhelmed by the numbers. The numbers are overwhelming, but my last blood donation took less than 6 minutes, and it only takes $1 to provide 3 meals. So thinking about what are small things that each and every one of us can do to make a difference.
And this partnership for this blood drive, food drive is incredible. Chelsea, what are you thinking?
Yeah, I think I echo the rest of the guests on this call as well, in saying that we are in this together and we'll get through it. I'm aware that there might be some fatigue with some of our news headlines lately, and our takeaway isn't that, we are struggling. We do need blood donations. We need food donations. We need help from our community. Our takeaway, though, that we want you to remember is that you can help. make a huge difference, especially this month. You can double your impact. You can help 3 patients. One blood donation can help up to 3 patients as well. And then with that $1 that we're donating to harvesters, that's 3 people who are going to be fed. This is a very tangible way that you can make a difference in a time that's a struggle for most of us. So that's what I hope that people take away from this message today.
I love that. $1 can feed 3 people, and 1 donation could potentially save 3 lives. Thank you all so much. And speaking of thank yous, March 30th is National Doctors Day, and we have a great way that you can thank all of our healthcare providers in the community. So many of you want to show your gratitude. So take a look at your screen right now. It's a QR code. This will help you do that. Once you scan it, it takes you to your email, and you can send a video. The video can be no longer than 25 megabytes, about 30 seconds. So it's a thank you video that you can do with your kids, thanking your doctors and our healthcare providers. Once we get those videos, we would love to share them on air. So send those videos to us. Thank you so much for being with us today. And remember, you can catch our shows anytime by logging on to Facebook, YouTube, and Twitter. And we know some of you might be looking for something nice to do this weekend. Well, why not grab the family and explore the Metro by checking out some of this beautiful heart work? More than 150 giant creative hearts decorated by artists across the Metro are on display across the community. Some of those artists are even our teammates here at the University of Kansas Health System. The Parade of Hearts runs for the next few months, and there's an app you can download so you can check them all out for yourself. The hearts are then going to be auctioned off to the public in June. Have a great weekend, everyone, and we will see you right back here Monday morning at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.